Last night at 10, the KSL investigators exposed critical gaps in law enforcement training when responding to calls for a mental health crisis. About 1 in 5 Utahns suffers from poor mental health.
Many end up either in jail or overwhelmed with health care costs. Tonight, investigator Brittany Glass takes us inside the first pilot program in Utah, providing desperately needed resources.
This program launched back in December and has been going strong for 7 months now. We do want to make you aware we shot this story just before COVID hit, which explains why we're not social distancing in the footage you're about to see.
Because I didn't want to ever go back.
24-year-old Kevin Kingsley is familiar with the criminal justice system.
First time I used drugs was in jail, methamphetamines.
He was on his high school football and wrestling teams when he was first arrested.
And so that's where it all started,
Instead of getting help,
I learned how to be a better criminal.
Kingsley also battles bipolar disorder.
I was very depressed. I didn't know what to do.
In January, after spending more than a year in jail and surviving 3 overdoses, Kingsley was at an all-time low.
Because I was in heroin addiction, and I was scared it was going to take my life, but I couldn't say no to the drugs.
That's when his friend dropped him off here, the Davis County Receiving Center.
Those are basically mental health emergency rooms where somebody can go, there's no refusal.
Representative Steve ELIASON says it's an alternative to jail or a costly emergency room for both low-level offenders or anyone struggling with mental health or substance abuse issues.
No appointment necessary. Just show up anytime, day or night.
Kingsley spent 3 days at the center to detox and got connected with long-term treatment. And so far, it's been successful.
I wish I had this when I was 18, because I would have turned my whole life around.
ELIASON says this approach tackles the core problem.
Looking at the underlying issues and treating those instead of just criminalizing a mental health or substance use disorder issue.
In his 32 years of service, Bountiful Police Chief Tom Ross says he's most excited about this new program.
Can you imagine a day when a police officer walks up to somebody that's in this vulnerable population and they are excited to see us or actually seek us out and be seen as a friend and a help and maybe someone that offers hope?
In about 7 months, the Receiving Center has helped more than 200 people. Without these services, 45% of those referred by law enforcement would have gone to jail, and 18% would have gone to the ER.
So as people are leaving here, they're in a better place.
And after 3 months, 78% of their clients are sticking to their treatment plan.
These are numbers that we're not seeing anywhere else.
But really, it's about providing them options and better places to go to get help.
Davis Behavioral Health CEO Brandon Hatch says he wants their clients to feel comfortable.
We're not a jail. We want it to be welcoming and homey.
I know you slept on one of these your first night, right?
Yeah, second one, right here.
Recliners, books, and motivational posters help it feel more like home.
Yeah, I love to read. I grabbed a poetry book the first day and just started just writing again.
Clients like Kingsley have 24/7 access to nurses, psychologists, and peer support.
When I'm in my addiction and everything, I like to put it on paper.
Best of all, the services come at no cost to the client.
They're not going to get a bill. They're not going to get charged.
Davis County Sheriff Kelly Sparks says the Receiving Center confronts the jail's revolving door that all too often replaces mental health and substance abuse treatment.
Just not a good environment to treat either of those things. They're coming in, they're getting arrested, and they're coming in and getting bailed out, and we're not addressing the core problem.
Sparks says the center reduces the burden on jails and increases public safety. An arrest can take an hour, but officers only spend about 6 minutes dropping people off at the Receiving Center.
And that gets our officers back on the street, available to respond to other emergencies.
I just had to trust the process.
As for Kevin Kingsley, it's changed how he views law enforcement.
I didn't want nothing to do with them, we'll just say that.
But today,
now that I see this, a lot of my mindset goes to, wow, they do care.
To have somebody in uniform who you were scared of coming in the first place, reach out a hand to you and say, I want to help you, and I can take you somewhere to avoid these criminal charges. This helps all of us.
Without the Receiving Center,
wow, I'd be in trouble, that's for sure. I'd probably be dead, so I'm grateful to be here.
Lawmakers recently passed new legislation funding 3 additional receiving centers in Salt Lake, Utah, and Washington counties. People can access centers through MCOT, mobile crisis outreach teams, police, or simply by walking in. Dave, Deanie.
Very interesting. Brittany Glass reporting. Thanks, Brittany.